docs, I'm going to be hosting some fantastic workshops in 2014. This one specifically has to do with what we call the art of the close. It's how to close presentations for action. You see, most of the time, docs that do health talks, in-house lectures, even corporate talks, the thing they lack is action. The whole point of you being there is action. So what we're going to teach you in this seminar series called The Art of the Close is how to get people out of awareness and into action. In other words, out of their seats and into your practice. There's some key things to do in this, and I've done this for 15 years. I haven't taught workshops in the last 4 to 5 years, but I'll tell you, this is a topic I own. This is enhanced and advanced information about doing corporate talks, because what we're going to really focus on is how to close it where you create new patients in your practice. And let's face it, doing spinal screenings, it sucks. If you spend 6-8 hours outside at a mall doing screenings in a public place, your results in doing health talks is going to be a decreased time and an increased number of new patients. You have more energy and free time for your family. It's good for any style of practice, cash, insurance. If you run a pediatric practice, this is the way to fill it up. Then you run it however you want to run it. But there's some key elements you need to know whether you go to this seminar or not. Number one, before you close a talk, you must, absolutely must, pre-frame it correctly. In other words, the setup to the close has to be done right, and then the close will work. What we'll teach you at the Art of the Close is 6 different closes. All these closes have been tested, they all work, but what happens all too often is docs use one close all the time. One close to every kind of audience. That's crazy. What you need to do is realize your audience, where you're going, and what they're all about, and then we will lay out 6 different talks. And it's like having different lures or going to a tackle box. You say, for this size audience, I'm going to use this close, and I'm going to set it up with this precept. That's how you get them into your practice. So it looks to be serendipitous, and maybe he got lucky doing his talk. That's not it at all. It's pre-planned and very much pre-framed, and we'll teach you how to do this. And one of the reasons we have 6 different closes is because the rules are changing, especially at corporate. You can no longer do lunch and learn talks and always do a close for $20. Always do a close to the charity. That isn't it anymore. Times are changing, and if you're still doing that stuff, you're stuck in the olden days, and pretty soon it's going to cost you practice. I'm not a huge fan of doing those Groupon ads. That's crazy. You couldn't pay me to do that because those people come in, they're tire kickers, they're Groupon shoppers, you know, they're like kind of like garage sale people. They go Groupon ad to Groupon ad to Groupon ad. You could be the 5th Groupon. Pre-educate, pre-qualify your new patients. And one of the key elements that we will teach you how to tap into is to use leverage points within your audience. That's how you get heavy lifting done. That's how you get a massive amount of new people to stand up and come into your practice, because in every audience there's leverage points. If you miss it, you're not utilizing it. And the other thing we want to do, and this is really key, is not only teach you how to be a better speaker, how to have presentation style, to use proper tonality, to do things in your presentation that work through the subconscious mind. What I also want to do is teach you how to be congruent with people's belief systems on a subconscious level. That's huge. So there's things and phrases we say through every 30 to 40 minute talk that we do that really hits the audience correctly. And let me be clear, if you're speaking for more than 40 minutes, you're speaking yourself out of the room. In other words, you're talking too much. Maybe just like I'm doing right now in this video, who knows? But the truth is, you talk too much, you'll lose them. If your PowerPoint slides are over 12 slides, it's too much, you're losing them. So we're going to teach you for 2 days, and we're going to role play how to, number 1, make you a better speaker. Number 2, how to pre-frame your close, and you can tie that into things that make them on a subconscious level buy in sooner. And then use one of 6 different closes. Maybe it's a close you're most comfortable with. Maybe it's picking the close for that audience. But we'll teach you new and improved options, things I know you've never seen before because I'm doing it. And we're even going to teach you how to do a 10-minute talk. If you don't know what that is, go to the website, find out some more information, because it applies the inverse law. Less time is actually getting more new patients. And you know what? If you're sick of doing Groupon and the tire kickers, you're sick of doing spinal screenings because they suck, come check this out. It's called The Art of the Close, because at the essence of your marketing, you should be creating new patients. And all too often we have chiropractors that are a little confused and they think marketing is all about education and passing out business cards. Wrong answer. Get them into your practice. Let's move the needle. That's what I'm doing in 2014. I've said no to some big stage audiences. I will be at CalJam. I'm going to be speaking for Life University. I've got some fantastic invites. I'll be over at the UK again, at the UCA. But I've limited to some pretty big and phenomenal invites so that I can dive into these workshops. I want to teach you what's going to move your practice. So we got to limit these seminars to 40 to 50 docs. That's it. We're going to sell them out. There's a premium on these things, but you'll get a jump stick you leave with. We'll follow it up with webinars. Just out of the close, get there. If you want to get people out of awareness into action, you need to be at this event. I'd love to have you there. Take care, docs. Let's make 2014 your best year yet.